What's up, everybody? Thank you for tuning into another episode of Dialed In. Today, we have a registered nurse, someone who also loves peptides and other things like that, and also someone who keeps me alive on a weekly basis with all the IV therapies I get from him. So, quick introduction from you, my man, and let's dive in from there.
Yeah, Kodi, thanks. My name's Evan Lutzi, registered nurse for over 10 years, in the ICU for over 10 years, and kind of got into this little more like holistic naturopathic field about 2.5 years ago, really diving into more predominantly like vitamin therapy and the peptide world, and really seeing all of the different health avenues, right, that we can be going down and utilizing proactively.
Got you. Okay. Well, thanks for the intro. Let's dive straight into it. I have a couple questions I want to ask you, and if there's ever anything you want to ask me or, dive into, just let me know. All right. So first off, what originally pulled you into nursing? So I know some people, everybody has a different reason as to why they want to go in the medical field in general, but what was your particular reason? And then I guess what made you go from what you were doing in an in-person, hospital, whatever you had going on, to you having your own personal clinic or whatever you want to call it? I guess kind of give us a quick rundown what the difference is.
Yeah, sure. Of course. Nursing really, I always someone that gravitated towards like science courses, someone that just really enjoyed helping people. So I went down the medical path, and then nursing kind of just, I fell into that route.
Gotcha.
Yeah, the original plan was med school, and it just diverted, and it was great because like nursing just gave you have so many options, different things you can do. So I'm glad it worked out the way it did. And then the transition happened really just working in critical care, seeing the importance of just fluid resuscitation, or having a good fluid status, fluid balance in the body, and how important that is for the body to recover and or just function on a daily basis. It was kind of like, I was like, oh, I could take my basic skill set of like starting IVs and running fluids and giving like simple things like anti-nausea meds, or like Toradol, it's like ibuprofen, right? Just like having those basic things for when people aren't feeling good. So I was like, that'd be cool as like a side business. And that's what, basically catapulted into what we're doing now.
Was there ever like a patient or a scenario or something that just made you want to switch right away? Or was it kind of just naturally happened on its own? It wasn't like you helped someone, you're like, wow, I could help more people doing this, or it wasn't like that?
It wasn't, because unfortunately in critical care, we're to the point that like people are so ill that we are utilizing and basically needing it's for like modern medicine.
Gotcha.
So there weren't too many instances there that there was like, well, we could have done this, right?
Got it.
But I do think that like the COVID, we went through that, and the preventative measures, I think that like people could have been doing simple things to just like also like strengthen our immune system. A lot of people are unaware or uneducated, and it's not necessarily their fault. So that is something, or like an instance, an event that I saw that a lot of people could have been doing a lot more to just try to protect themselves.
Understood.
Yeah.
Not gonna lie, I remember in the COVID era, that was the first time I saw people at the gym wash their hands. It's the first time I saw anybody do anything clean. It's like, man, we're gonna be killing all kinds of viruses now.
Yeah, crazy. Yeah. It changed the ways for a lot of people.
Gotcha.
Started new habits.
Some not so good ones either.
Yeah, exactly.
All right. So following to the next question. So what was the hardest part about going from, let's say, you being employed for a particular business where like everything kind of given to you because you work for them, versus now you're your own business owner and you have to attract clientele, you have to attract customers? Was there anything massively different?
Exactly that. It went from you just having your required list, right? Your job duties being set to I got to do everything.
Gotcha. Do you miss it? Or do you still do that at all? Like doing nursing?
No, I've left. Yeah. This past summer, I left the bedside permanently. Well, at least for now.
Yeah.
I do miss it though. Yeah, I miss the critical care aspect. I miss thinking on such a critical level, really applying all that knowledge. And like at the end of the day, like, we were saving people's lives. So
yes, I know quite a lot about the emergency room. You guys are quite helpful.
Rewarding feeling.
I had one follow-up question though, just because a lot of my followers and even my own clients are in the medical field. I have nurses, doctors, surgeons, x-ray techs, anybody who's in the medical field who sometimes feel, how do I word this? Like they don't have enough free time to do bodybuilding. They don't have enough free time to take care of themselves. And it almost seems like a common denominator of like, they focus so much on saving people's lives that they forget to help themselves. Have you ever noticed that with yourself or any of your fellow colleagues where they just help people? They come home and eat like shit and just don't really take care of themselves because it just doesn't cross their mind.
Yeah. I mean, they'll say like, people in the health field, nurses, doctors, everyone, we're the worst patients. we'll give all the advice, but then we don't necessarily take our own advice. But I mean, personally, from a time perspective, I had way more time when I was working in the hospital. We did 312s. So it's like, we do 312s. I have 4 days myself. Even if you want to call one a recovery day, right? Then it's like, I had 3 open available days to kind of do whatever I wanted.
Can you do more though? Can you have like 512s or is there like a limitation that you're like, it's unhealthy?
Depends on facility. Some will cap like how many you can do in a row.
Got it.
At that point, you're looking at OT, so it has to be approved. But most places are wanting extra help, so it was never an issue for me if I wanted to snag extra hours.
Gotcha. Okay, well, let's start getting some good topics here, I guess. This is more of a personal question here, but do you feel that now that you have your own practice and like you kind of make their own rules within reason, that you could prescribe things that actually work when maybe when you were a nurse or people in the medical field, they can't do things? I don't know if my question makes sense, but you could give something that for a fact works, but it may be against a protocol as a nurse or doctor, something like that. If you can answer that, of course.
Right. We're not, like in clinic necessarily. I mean, I guess like some things like weight loss, we're like prescribing, right? But a lot of this stuff is, essentially natural. So it's more of like, hey, this is like a guided protocol type thing. Not really.
Gotcha. I didn't know if there was just one specific instance where you're like, oh, well, they said I can't take a healing peptide and you're in your private practice like, this shit works. I know this shit works. A lot of people take it, but there's no specific scenarios. I was just curious.
No, I mean, I guess it was a friend of mine. So it's an instance that like, I knew we were okay. I'm not going to give any specifics.
Of course.
And we were okay to operate. But I told him, I was like, dude, if you were to go to any other, like, maybe in the hospital, sure. But any other like hydration clinic, like they would not have taken you as a patient. You were essentially, you would have fell into criteria that they would have been like, we are not proceeding.
Damn. See, well, saving out here, saving lives. So that leads me to my next question here. So it could be two, I guess it's a 2-part question, but where do you see this industry going in the next 5 to 10 years? Just the hydration industry, anything where it's like, you're the biohacker. And what do you feel like, what do you wish could be different, whether it's better or anything? What do you feel like could be better, or what could they change to make your job more efficient? Maybe get clients the care they actually need. Anything specific?
Yeah, a bunch of things. I think the knowledge and the awareness that like even just like IV therapy, hydration, is an option, is available outside of like an urgent care or a hospital. Fun fact, I don't know if it's a California thing, but like, I don't know if any of the urgent cares here even offer IV fluids. I've had so many people come to see me because they're like, yeah, I just came from urgent care and they wouldn't give me any IV fluids.
Yeah,
so
I can confirm they did not give it to me.
They don't. Yeah. I don't know if that's a California thing or what, but I think like the awareness of these types of services being available is growing. So that's just going to, become a bigger more impactful in the next 5 years, right? Everyone being aware of what they can utilize, the service they can utilize. Peptides are, and as you know, they're making a pretty big push. Same thing. People now know the word peptide.
Yes.
They don't know. They don't know.
Very much so.
But they don't know what it is. What do they do? Anything like that. But we're all seeing, I mean, in our clinic ourselves, right? It's just like really good outcomes, really good results from utilizing peptides. And so a lot of this like preventative or rejuvenative like health and practice, I think you nailed it on the head. Like that, like 3 to 5 year range, it's going to become a lot different because it gives us a great way to like prevent a lot of like diseases, right? Prevent a lot of any type of medical issues that people are having. It's a healthier way. It's a healthier lifestyle, healthier body.
So following up to that, what are some peptides that you, I guess you could say, commonly give at your clinic, or maybe anything that you're on? I want to talk about some of the ones I love, but I guess started off, what do you feel like is the best that people should be looking into?
Yeah, the two biggest ones that I recommend to almost anybody, or that I've seen firsthand, or I've heard from people as far as having like really great results, is BPC 157 and TB 500.
Nice.
Those two have been top notch.
And for the people who don't know shit about peptides, give us a quick 30-second breakdown of what you've seen it help with specifically.
Yeah. So really good for, right, it's recovery, rejuvenation. So if you have any injuries, healing from surgeries, you can even just use it for just like general wellness if you're training really hard, or even not even that hard. So what they do is, in a nutshell, really strong anti-inflammatory properties, right? So it's reducing inflammation. So that helps with their recovery process, helps with pain. They also create additional blood flow by forming new capillaries. So the blood flow is what helps our body heal. So when you have injuries, that's what helps these injuries heal faster.
Cool. So following up to him, I agree with that. Probably the most common I've given now would be a top 4 would be the healing peptide, or the Wolverine stack, which what he said, or just call it the BPC and TB 500 blend. Amazing. Retta is up there for sure. I know it's an iffy topic right now, but probably the second most popular one my clients are on, or everybody I know is on it. It's a GLP-1 appetite suppressant, also has some fat burning characteristics, almost like Ozempic 3.0 would be the best way to word it. And then the other one would probably be the GHKCU. That one works relatively well in terms of it just makes you look younger. It makes your skin look tighter and have like a youthful look to it. I will sometimes stack GHKCU with like an NAD plus and get a lot of benefits from that. But now that we're on the peptide talk, let's just dive down that rabbit hole and just talk about some of the other things you do at your clinic, or things you've seen. You know, like anytime I go, someone next to me is getting some other weird concoction. So I kind of just go through and tell us what some of these major things are, or maybe even what's even like an IV bag. You don't even know what's in it. So kind of dumb it down a little bit first.
Yeah, sure. I mean, I'll just focus on kind of like the things I really like. I like to focus on like mitochondrial health. So antioxidants are key. I have a lot of people coming in and just saying like, I'm tired. I'm all the time, like just chronic fatigue. And I think it's like that exhaustion is generally more like mental, right? Cognitive exhaustion, kind of like burnt out, not necessarily the physical exhaustion. Yep. Great example real quick, just of like one of my clients came in, and to kind of explain the difference was, he's like, yeah, I went from field work to like managerial work, and I'm behind a desk all day. And he was like, I was wiped by the end of the day. And he's like, I did absolutely nothing. I just sat there. I'm like, yeah, like, but you can get burnt out, like mentally. So there is a difference. A lot of people just think physical, right? So yeah, mitochondrial health, antioxidants. So mitochondria is the powerhouse of our cell. ATP production, energy. So we want to focus on things, glutathione, master antioxidant, ALA, alpha lipoic acid, NAC, one of my favorites, N-acetylcholine, CoQ10, those are like 4 big antioxidants. And then MOTS-C really focuses on mitochondrial health. Probably my favorite peptide. I'm trying to think. But yeah, for like cognitive benefits. And you did mention NAD. But yeah, MOTS-C is proven to really help with cognitive benefits. That's one of the bigger things. So like for like general wellness, right? I love MOTS-C and GHKCU.
Got it. So I'm gonna just throw a couple topics at you and just tell me what the best peptide would be for it in your best opinion. Just the main ones people would ask me before I planned for this. So let's go. Someone is hungover, nauseous. What are they doing at your clinic?
Oh, I mean, they're getting we're going medication. We're gonna hit them with fluids, right? Because they need the hydration, but they're gonna get Zofran, anti-nausea med, Toradol. It's like ibuprofen, but an IV. Pepsid. It's an antacid, but Pepsid helps take away inflammation in the gut. That's also helping or causing like your nausea. But then B vitamins are the real big one. Thiamine, specifically B1. Alcohol depletes your B vitamins, so you got to get those Bs up. So if you want to be smart about it, and you know you're going out drinking, have some B vitamins or a lot of B vitamins on hand, and start hitting them heavy that day before you start drinking.
Can you tell the people what the difference is between an injectable vitamin like they get from you or IV based vitamin versus like the pill version? Can you explain like what the difference is for people who don't know?
Oh yeah. I mean, for the most part, the vitamin's the same as long as you're getting good quality. That's something we can touch on a little later if you want, as far as like quality of supplements.
Of course.
But oral, obviously you're taking it by mouth. So it's going through your GI, your GI system. So our absorption through like our gut, through our stomach, through our intestines, give or take, around 30%. So the bioavailability, how much the body can absorb, is much lower. So that's why people come in with a hangover and get an IV. It's going right into your vein, right? It's intravenous. So you're absorbing 99%, if not all of it, if not all 100% of the fluids and the vitamins immediately. So that's the difference, is you're going to absorb it right away, all of it as well. And that is one of my prime examples I give to people. They're like, when I have a hangover, why does it last or take so much longer when I'm pounding water or pounding Gatorade? And it's because it's got to go through your GI system, and it's just not as efficient. It's a slower process. Obviously, we're built that way, right? But yeah.
All right. And then let's go one more then in that category. So we already kind of covered energy. We just covered nausea and all that. Let's go one of the more popular ones, especially in the bodybuilding world. Or let's say someone's going to like EDC, like a big rave. What could they do to maybe boost their metabolism, their immune system up, or someone who is actively sick and trying to recover from it? What is just something that's good for people who have autoimmune diseases or immune system issues if they're currently sick? Anything in that realm?
Yeah, vitamin C is very powerful. I think a lot of us know that vitamin C is good for our immune system, but take higher doses. Up it. These are all water soluble vitamins. If it's too much for your body, which I doubt it's going to be, you're going to excrete it. Now, again, spread that out there throughout the day. Don't take like 4,000 milligrams at once. Your body can only absorb so much at once through the gut, right? And that's why when you take a multivitamin, your urine turns like fluorescent yellow.
Right, green.
Right, yeah. Your body couldn't. It's not that you were taking too much. It was too much at once for the body to really kind of absorb. So I like to say like 1,000 milligrams, 2,000 milligrams, 3 or 4 times throughout the day. If you're trying to boost it ahead of time, like preventatively. or even if you're sick. Zinc's another great one, underutilized. I feel like you can take up to 40 to 50 milligrams a day. Really good for your immune system. That's what's in Zicam. Zicam's advertised to like shorten the duration of colds, and it's true because zinc will do that.
Is that the Zicam no swabs, or is that a pill?
I haven't had it in a while. It might dissolve in your mouth. I forget, but
got it.
Yeah, dissolvable, or who knows what they have now. I haven't used it in years, but
they got a lot.
Yeah, but zinc will make you nauseous, right? Very common thing. So definitely take it with food. And then go ahead.
I had one thing relevant to this, but we're talking about related. This somebody asked me this specifically. With the term inflammation being thrown around so much, what would you give someone that is suffering from inflammation? Whether it's they just got done doing a bodybuilding show, they just got done doing a marathon, just something where their body is obviously inflamed, and that's kind of the last like random specific topic to go about that. Just how do you get rid of inflammation, or what would you do as the one who would be helping them do that?
If it's acute and someone's needing like immediate relief, they come in, they're just, hey, but my back's killing me, my ankle's killing me, something like that. We're going down the farm route. We're going to use like the Toradol, or we can use a corticosteroid. Those work really well. As far as like maintenance and continuous treatment, just that keep the inflammation down for your body. Again, antioxidants. So your glutathione, your NAC. NAC is one of my top recommended supplements for people to take daily, because there's so many things out there. You have to pick and choose, right? Of course. But it's a great antioxidant. It's also a precursor to glutathione. So it's going to promote, it's a building block. It's helping with the production of glutathione naturally in your body. Because glutathione is not absorbed well by the gut. It's very fragile. It gets broken down very rapidly by your bile. So even in a liposomal form, it's like, how well is it being absorbed? So it's really hard to supplement glutathione orally. Obviously, IM injections, IVs, fantastic route. So we have to look at other ways to boost that level too. And NAC is probably the best way.
If you had to pick between IV versus intramuscular, or just kind of give us a quick breakdown what the difference is, can you break that down for people who don't know?
Yeah. So your typical shot, right? When you go to the doctor, they give you a shot. Normally it's in your arm. That's intramuscular. It's going inside your muscle. Now, if you're choosing between the two, the time, the shots are quick. But then the upside of the IV is the absorption is going to be pretty similar. IV is better, but it's not to the point that it's, I would say you'll still get benefits, right? Really well benefits from intramuscular shots. But in the IV, you can do larger doses. And if you're needing to do multiple things, then it saves you from getting 4 or 5 shots. It just goes into the bag,
Understood.
The dosing's big though, because you're kind of limited, typically 2 or 3 mLs. 3 mLs gets to be a lot. So it'll be a little more uncomfortable. In the bags, you can really kind of, when I say bags, I mean the IV fluids. You can throw in a much higher dose of these vitamins.
All right, cool. That's all I got for that. You could answer either part of this question, but what do you feel like is most overrated vitamin, shot, peptide, or maybe a myth that people think is good, it ends up not being good? Just anything in that realm. What is something that people are like, that works? I know for a fact it does, but it indeed does not work, because it doesn't work. Anything that comes to mind?
I would probably say like trying to utilize oral glutathione or NAD. A lot of I'm not going to say all, right? So everyone's body can be different. How well it can absorb something, et cetera, right? Some things work really well for some people where it doesn't for others. And that's how it works with like medications too, right? That's why we have so many different medications that do the same thing. We can give a blood pressure medication to one person and it doesn't help their blood pressure. So then we try a different one. But I think like the oral form of glutathione or NAD, just, I mean, I don't really promote it. I'm like, if you want to take something and you want to spend your money, I don't think it's where the money is best spent. If you're looking for something that you can take consistently at home, I would actually advise like take NAC, the precursor to glutathione, or NMN, the precursor to NAD. Most people that I've talked to, some of my patients that come in and that are utilizing some oral brands of glutathione or NAD, most say they haven't noticed a difference. Some have said they think one or the other has helped, but the majority is no.
All right, cool. No, that's all I got for that. Let me see what else I got for you relevant to this. Oh, that's pretty good. Now, assuming that people are just having all the money in the world for your IVs, peptides, they have everything all together, but their sleep is dog shit. What would you say, how important would you say that's still going to be when it comes to recovery, growing, anything at all? People do everything right, and then they get like 3 hours of sleep a night. How detrimental would you say that is to just your general body?
So it's so detrimental. Sleep is probably the most important thing that we can do for our body in terms of health. It impacts everything. It really does. If you're not sleeping, you're recharging your body or your battery, right? And if you don't do that, everything can get thrown out of whack. Everything will run less efficient. It's going to impact everything from your metabolism, your recovery, even your diet. Like when it's proven, isn't it? Like when you're tired, you actually become more snacky.
Yeah, that and the other thing that comes to mind is even if you weren't more hungry, think about how much or how less steps they're getting. They're not motivated to walk around. They're just kind of slumped over, kind of going through the motions. Their normal step count goes down. So now they're less active. Now they burn less calories anyway, regardless of if they're snacking or not. Then you add snacking on top. Now they're double cooked. It's a bad time.
Exactly. Yeah. Sleep is so vital. It needs to be prioritized a lot more by society.
So in a simple yes or no, you cannot outwork or out supplement or out peptide bad sleep. Is that safe to say? Okay.
No.
All right.
You can improve it, like improve your sleep quality.
Have you noticed any new modern chronic illnesses or any illnesses at all that have been cured or fixed or mitigated solely from peptide use or anything that you've given them? I have one example on the top of my head, but do you have any on your end that you're like, hey, I gave them this peptide, I gave them this cocktail, I gave them this, like they just somehow got better when, maybe the doctor said that wouldn't fix them or anything that comes to mind at all?
Sure. I can say I've had a couple patients with psoriasis.
Mm-hmm.
And they noticed a huge, it cleared up a lot.
You have to explain what that is. Not everybody knows what that term is.
So typically, markings, a lot of markings on the skin, right?
Got it.
Yeah, we'll keep it simple.
Sure.
So those like blemishes, it's like blotchy, right?
Yep.
Red and blotchy. Those can get cleared up a lot with like a higher dose vitamin C and glutathione. So I actually do like to use that example a lot just to show the power of antioxidants. And vitamin C, for those that don't know, is an antioxidant. So yeah, that's something that like overnight, right? Like this is something that the next day these patients have reached out, and we're doing really the treatment was because they were sick.
Yep.
And they're like, hey, my psoriasis looks a lot better. And I'm like, yeah, that makes sense.
So it's a win-win.
Yeah.
Okay. Cool. Now I was curious if there's anything that popped off. Let's see here. Already got the antioxidant question. Already got that one. Yeah, this specific one. Outside of nootropics, what would you give or tell someone that they might want to look into that is solely for cognitive focus decline? They're not thinking the way they used to. They're forgetting things. Anything that's just solely for the brain health. That's not, synapsin, dihexa, anything that's not a nootropic per se, if you know of any.
Yeah, I think we might have briefly touched on this.
Yeah, I know we did in the beginning.
Yeah. So MOTS,
Yep.
glutathione, NAD.
And if someone has severe brain fog that they can't even like think clearly, you think that would be sufficient to do it?
If their sleep's good.
There we go. I like it. I like it. I want, this is kind of something related. So I'm so you take caffeine, correct? At some point.
Actually, very rarely now. And I keep saying this, but it's like, it's so powerful. Glutathione. Once I started doing weekly injections, within 2 weeks, I was off my morning coffee. I wake up feeling good. Don't need it to walk out the door.
What was the dosage you were doing? Was like 500 3 days a week, or were you doing a lot or a little?
No, I was like a cup a day.
Not for the coffee, for the glutathione.
Oh, the glutathione.
I was like, I mean, coffee can't be too much.
400 milligrams a week.
Oh, okay. Not even like 500. Man, the bodybuilding protocols are like almost 1,000 a day. Like they're up there.
Yeah. Is that sub Q?
Intramuscular only.
Intramuscular. 1,000 a day?
Yeah, sometimes they'll do upwards of 5,000 to 10,000 per week. But they're trying their best to detox anything that, like, they're already pounding 10 oral steroids. But so I don't agree with the dose, by the way. I'm saying that's what I've seen people do.
Okay, I'm like, that's really high.
Yeah. I will usually give people 500 3 times a week if they're on some steroids, but I don't do 1,000 per day. No.
Okay, that makes sense. Yeah, I mean, we'll do like up to like 3,000 a week.
Okay.
And which is a hefty dose, right? But you can get, now again, everyone's different. I've had a lot of my patients, it's just like a shot a week. They'll come in, they get their glutathione shot for the week. They notice a difference. Can you do more? Absolutely. Will it help more? Most likely. You had said something that triggered something, but I lost it.
I was talking about, we were mostly talking about brain focus and mental clarity first. Then we went over to glutathione and bodybuilding. And any of those ring a bell?
Oh, the bodybuilding. Yeah. They're also just working out, right? The intensity and the frequency is pretty extreme, right? Yes. So their body is probably metabolizing a lot more than most normal people. Actually, not probably, it is. So they're going to burn through a lot more of all their resources and need higher doses. So again, makes sense for them to benefit and need higher dosing of glutathione, but still 10,000 seems extremely high.
Also very expensive too, like even if we didn't take in the dosages, like how much per bottle is that,
Yeah. 10,000 milligrams minus 18. Oh my God, that's multiple vials a week.
Oh, yeah, it is. That's what I was saying. It's expensive.
Like almost a vial a day.
Okay. If so, and I guess we could both answer this, but if someone was new to vitamins, minerals, is trying to get themselves in shape, maybe they only want to inject it or get an IV, what would you say your go-to like vitamins are, or anything you think that the average person should be taking from a medical professional standpoint?
Yeah. And you said did not want to do injections or IVs?
Yeah, no, solely just the average mom and dad that's like, hey, I'm maybe a little tired, or hey, I get sick often, just normal stuff.
NAC is top of the list for me.
Definitely.
That's definitely one of the top recommendations I would give. Magnesium is very important. It helps reset the central nervous system. So
which type for that though? Magnesium, was it glycinate or magnesium sulfate?
Yeah, I like glycinate.
Okay.
That's one of the go-tos for also like sleep support. Most people take it at night. You can take it whenever. But it's a natural relaxant, right? So it'll kind of like calm you, not make you sleepy or drowsy, right? Not like Benadryl. And then NMN's a big one. NMN or NR, precursors.
I don't think I know that one. NMR.
NR, NMN and NR are the two precursors for NAD.
Okay.
Yeah. So they will help with the production of the natural production of NAD. So energy, mental clarity. The dosing for those is a little higher. I feel like even higher than I think I've seen on some of the suggested dosing on some of these companies' bottles. I would probably shoot a little higher than that. So, and that's where it's hard. Like for those, it's we don't have great reference ranges. So sometimes it's kind of like start with it, see if it's working. If it's not, increase it type thing. Methylene blue. What's your have you? Yeah.
So I'm a 50-50. I remember I was a big RFK fan. Some of the things he says is insane, but some of the things I do agree with. But I remember he was drinking it, and then like, oh, what are you drinking on the plane? It's like, oh, I'm doing the methylene blue. So I started looking into it, and it's like, has this percent of increasing cancer? Has this? I was like, holy shit, bro! Like, I don't know what to believe here. I haven't tried it, but when I was looking at it, like, it was very contradicting. Most peptides and most compounds and most things, it's like it does this, and this. This is the potential risk. This one's like, it kills you. It's good for this. It could harm this. It's good for this. So I genuinely don't know. If you have any insight, I have none. I don't know.
Yeah, we would use it. It helps really spark energy on a cellular level. So in the hospital settings, it was more or less our like last ditch effort. If someone was dying,
yes,
or coding,
they give methylene blue for that.
They have,
Wow.
yeah. It's kind of like it's almost like a Hail Mary in the hospital setting. So, but yeah, you get the spark. So it's something that I feel like you can use also kind of like as needed. A lot of people have said that they've noticed even just from like a one-time dose, just getting a nice mental boost, cognitive boost. So they could even use it like halfway through a day or something to kind of prevent like burnout, things like that.
Do you know the dosages off the top of your head? What is considered like low? Like it's a compound I'm not familiar with at all. Do you even know like what's considered low, or you're not familiar with it?
10 milligrams is your, as far as I'm aware.
Yeah.
I take 10 milligrams when I use it.
And how often do you personally use it?
Couple times a week. Yeah. I use that kind of as my backup, my reserve. I'll have what I take daily. And if I'm still feeling like sluggish or it's like a long day, then I just grab that. I use the tincture, so it's liquid. So
gotcha. Okay, I got to look into that. I might need to carry that in my store. If that's people ask them, I just don't. I haven't seen enough about it to like give my genuine opinion. But okay, do you know much about SS31 by any chance? Have you ever tried it, or do you know much about it? It's getting really popular now.
Yeah, it's becoming popular with right, especially in combination, stacking it with the MOTS-C.
Yes, it became popular maybe 2 months in my world. A couple months ago, one of his famous competitors was one of the best bodybuilders on earth. He said that right when he gets done bodybuilding with his hardcore prep, he does 3 weeks of the SS31 and then 3 weeks of MOTS-C, and all his lab work is flawless. His inflammation's down, his cortisol's down. He said he's never recovered post-show like that ever since his tube came out, and he swears by it. And then it just blew up overnight. So I haven't tried either. I have a lot of guys on MOTS-C, but I haven't tried the SS31. But if you have any insight.
Yeah, I haven't either, unfortunately. But it's something I want to bring in with some of the individuals that are a little more hardcore, if you will, with the peptides. Like really, really enjoy to promote the usage of that, or like want to use more peptides. So yeah, it's something I kind of want to explore a little more myself and get some more feedback. But everything I've kind of like seen and read is it really amplifies that the MOTS-C. Now I've again using, and you said it yourself, right? MOTS-C does work.
Yeah. Very popular
by itself, right? Because I did see this one video saying that like you need both for it to work. It's like taking MOTS-C without SS31 is stupid, and it's like, well, that's not true.
Yeah, sometimes, and this is just my quick rant. Sometimes my clients have asked me things like that too. I'm like, where did you hear that from? And they'll send me some like random peptide selling store. I'm like, well, yeah, bro, they're trying to sell you more. Like, I have my own store. Like, of course, I'll tell you guys what works, but I'm not going to be like, you need to go buy 13 balls of MOTS-C, 7 SS31, and if you don't get the NAD plus, it's not going to work. Like, you can tell, right. especially with the AI, they know that it's bullshit. That's why they're not even having their face representing it. You know, you got to pay attention to who the messenger is.
Right. No, 100%. Yeah, I feel like a lot of people just hear or see one thing online and it's true all of a sudden. Like, that's a message we can also really try to like reiterate or just reinforce to people, is like, do your own research too. You know, if you see something, like, check the validity behind it, see what else is out there. Now more than ever, if you see it on the internet, there's probably a better chance it's not true than it is.
So I have one question for you, and I want to, you know, I'll try not to go off too much in the tangent here, but when you didn't go to medical school, when you were going to nursing school and doing all that, like, do you feel like there was limitations to what you were taught? Like, I'm sure they didn't teach you about peptides, right? Like, do you feel like there's certain things? So how do you feel about when you see, like, let's say, I know you're not chronically online like I am, but you'll see doctors or nurses like with the stethoscope and they got everything going on, shooting their videos like, well, BPC does this, this, and this, but you also need to stack in these 13 compounds. And like, they're using their authority as them being doctors or whatever to say that. But what if they never learned that in medical school? They just happen to be a doctor, you know?
Yeah. Well, I'll tell you, they definitely didn't learn in medical school.
did or did not?
Did not.
Okay.
So no, correct. They're using their title to support some more like validity. Mm-hmm. Now, I mean, if it's something that they're, you know, that they use in their practice, right, and they have a good like background and knowledge base of, then awesome. But yeah, you don't know if they're doing some of these videos. Do you even know if they're doctors?
You don't. And what I was gonna follow up with, there's this one white dude. A lot of people who are chronic right now would know him. He's always in his like beat up Honda Civic car. And like, he's not a doctor. He's just a normal guy with a doctor outfit on. And like, he'll like keep selling all the stuff on TikTok shop. I'm like, this guy's not a doctor. How do you guys keep falling for it? He's never once say he's a doctor. He just has a doctor outfit on.
Right.
He's like, in my personal opinion, and trust me, I know a lot, these are the vitamins you need to take. You can only get them right here, shop below TikTok shop. It's like, bro, he's not a doctor. Stop buying what he's saying.
Yeah. No, and when in the peptide world, like being a doctor, being in the medical field does not validate our knowledge in the peptide world. You know, if the experience, you know, is it utilized in their common practice? Maybe like a pharmacist, right? The ones that are compounding these things, could trust them. I'm sure they know a ton about all of these peptides and different compounds, right? But yeah, I mean, you're not a doctor and you're very well versed in peptides.
Not a doctor.
Not a doctor.
My nickname is Dr. Dial, but I'm not a doctor, guys. Not a doctor. But let's see here. That's pretty much the main question I had. Everything else I'm just going to spitball and ask you randomly. But was there anything you wanted to touch on? I know we talked earlier about vitamin quality, but was there anything you want to dive into before we go into that? Or you want to just kind of go down and see where it takes us?
Yeah, let's just, there's nothing off the top of my head right now. So we can just kind of like go down that topic and see.
Sure. Yeah. So I want to get your opinion. And while you're here, I might have briefly touched on it, but as you know, I have an autoimmune disease. I have mast cells. I'm allergic to life at this point. But
Unfortunately.
I had a passion. It's kind of popped in my head the other day, and I was like, man, I was looking at all these vitamins, and I was like, man, this has 30 fillers, this has 5 fillers, this has 3, and there's only a very small amount of products in the market that have like no fillers in it besides the gel capsule, whatever capsule. I was like, man, like, why can't I make dialed in nutrition? So called the manufacturer, talked to them, told my vision, like, oh yeah, we could do that. Just nobody wants it because it's expensive. It's like, wait, so the only thing stopping them from like having a no filler or 1 filler item is like just they don't want to pay the extra 30 cents per bottle. Like, yeah, pretty much. It's like, oh, that's crazy. Why can't I do that? It's like, well, you can. So I guess just let's dive into that topic. Any insight you have from vitamins, minerals? What should people look out for? Is it the super? How do I word this? I got asked yesterday, do I want to join a vitamin company that's for Black people only? And I asked them, like, what does that mean? Like, it's for people who have dark skin, black skin, like it's made for Black people. And I was like, but I'm only half Black. Does that count? And he left me on red. So I guess he didn't know what he was talking about. But I guess just when they have all these crazy claims that these vitamins are for a particular demographic of people, is that bullshit or not? So let's dive down that rabbit hole.
Well, I mean, different demographics that may need, our bodies are different, right? Yeah. So if you look at like the Asian culture, there's certain things that their body like can't break down. A common one I think a lot of people are aware of is one form of alcohol. Mm-hmm. And that's why they'll get like really flushed.
That is an Asian thing, huh? I thought that was a myth until I saw it in college. I didn't realize that was like not a myth.
Yeah, no, it's actually real.
Wow.
So I mean, sure, I guess, but in general, quality, right? So what we want to focus on here is quality, I think, more than anything. The biggest message I try to send to people is don't buy your vitamins off Amazon. I say don't buy anything you're going to put in your body off Amazon. There's no quality protection. No one's checking any of the products, right? And also I've heard from brands saying like, hey, don't buy our brand off Amazon because it's not ours. So you just never know what you're getting, right? And if you're putting
I have heard that specific thing.
That same thing, yeah.
Do you know the brand Pure? It's just called Pure. It's one of the best brands supposedly. I had the real one from their website, and they ran out, so I ordered on Amazon. It was a different bottle, different label, and the pills were different. So I asked them, like, "That's not our bottle." It's like, "It's on Amazon." It's like, "Oh shit, okay, well, never mind."
Right, and like, how do they get away with it? I don't know.
Yeah, it's Amazon's strict too, so I really don't know how they get away with it.
Yeah, I know. So I mean, I know you get the convenience from Amazon, and like it's a little cheaper, but the $3, maybe $5 that you're saving, spend it because you're putting it in your body, and this is over a month, right? So it's like,
of course,
pennies on the dollar per day. Like, put that into save that for your body. You know, invest that little bit in your body. So yeah, don't buy off Amazon. Check that the vitamins are third-party tested. Those are the two big things: third-party testing, making sure you're getting the quality vitamin. Now, are we in the era where like anyone can kind of post that they've done third-party testing? Like, maybe,
yes.
You know, so definitely look into like the validity of their testing. Now there are some sites, like I know we're able to use, am I allowed to, like, I can mention like product names?
Yeah, whatever.
Okay.
No
so we use Fullscript. Fullscript is basically a vitamin catalog that was created for physicians. So you have to be a physician to make an account, but then we can make patient accounts, right? Accounts for our patients. And they were created basically to give a reputable resource for a vitamin. So basically any brands they carry, they vet all these brands, make sure they have the third-party testing done, look into that, saves you the legwork, right? So I don't know if there's like a public company kind of like that.
That's the only one that I know, because a doctor signed me up for that too.
Yeah.
That's how I learned about the best brands: Pure, Life Extension, all the other, like the ones that have minimal fillers. The ones that I was like, okay, these are great. I want to be like that company one day.
Right. Yeah. Thorne's a big one. A lot of they really focus in like the athletic world, sports world. But yeah, I mean, there's a ton of brands on there. So I tell everyone, I'm like, if they're not on there, it doesn't mean it's a shit vitamin, right? Yes. They just might not be on there. But yeah, that saves the legwork. But definitely, I would say like do that legwork, look into the third-party testing, and make sure it's a good source. Otherwise, you're just kind of wasting your money.
Yeah, especially if it's fake. What if it's just a water pill? Like there's nothing in it. Random.
There was this video. I have it saved on in my Instagram. This guy just went over like this testing. Harvard did a test of like 57 sports supplements or something like that. And it was long story short, it was I think it was like 6 or 7 actually tested to have the
ingredient.
The good part of it, to actually have what it was in the vitamin or in the supplement or listed on the bottle was actually in the supplement. And it was like 98% purity or higher. And they didn't have any FDA banned substances. So only 6 out of the 57 they did.
50.
Yeah. And it was under, at least under 20. I forget the exact numbers, but it was a very low number. Had 10% or less of the like main ingredient. So
what was in it though? Was it just fillers?
I guess
did nothing.
They didn't go into that, but it was just like what you were buying it for wasn't even in it. Basically, it was less than 10%.
Yeah, they do that. I see that a lot in vitamins for sure. But the biggest scandal that happens usually every 3 months would be a protein company, like a protein powder. And they'll have this outrageous claim. And anybody watching, you guys know who I'm referring to if you guys are chronically online. But they're the ones who have the cookie dough flavored protein, all these crazy unorthodox flavors. But they claim it's like 28 grams of protein with like no sugar, no nothing, but it just tastes like cookie dough. So they send it out to lab test it. It was actually fucking cookie dough. It wasn't even protein. You were just putting cookie dough in your protein shake thinking you were getting protein powder, and it was 2 grams of protein and like 85 grams of sugar. I was like, how did they think they can get away with that, bro? Everybody's out there like is going to look it up eventually, you know? Insane. Insane.
Yeah. So yeah, there's the companies out there, right? They lie, obviously.
People just want money, man. Now that I own a peptide company, I've seen people try to poach me to like carry their product. They're like, bro, like we get it straight from China, we get it from here. Like, don't even worry about the purity. Just pay us like 30 cents a bottle. I'm like, no, I don't even know what's in there. We're going to kill a freaking researcher. No, we ain't doing that.
Right.
So some people just chase the bag, and that's not a long-term sustainable, at least not my eyes.
It's crazy. I know. And then like, not even to get into like the morals and ethics.
Yeah. Unfortunately, most people, I don't know how to say this. From what I've seen, some of the richest people I know have the poorest morals. It's like they've made it so far that they just don't care about the average man and woman anymore. They're just trying to get filthy rich. They already have 20 million. They're trying to find whatever they can do to get to 100 million. They will do anything and throw anybody under the bus, which sucks. I don't understand. If I had 100 million, I'm doing everybody right.
Right.
To each their own.
Greed, man, greed. But
right. I'm trying to think if there's anything else I want to ask you here. I covered all the peptide things. I guess you could tell, what are you currently on? I know you mentioned like occasional methylene blue. Is there anything that you're on that is unorthodox or different or anything at all?
I do the weekly glutathione shots. And then anytime I do an IV, I throw anywhere from 1 to 2 grams of glutathione in there. For anyone that does do IVs or wants to do IVs and you get glutathione, make sure it's given as a push. And what that means is it's like pushed in the side port of the tubing, not put into the bag. Glutathione is, as I mentioned earlier, very fragile. So it can break down very quickly when it's not at like refrigerated temperatures or exposed to light, or also mixed with other vitamins. Vitamin C specifically does break it down. Now, again, this is like takes time, 10 minutes or so, but your IV is going to run well over that. So, yeah, given as a push. But yeah, so I do I utilize glutathione weekly. I am using, as far as like oral supplements, I do take a multivitamin. It's just like, it can't hurt type thing. Get a little bit of the minerals, and other trace vitamins and things. Check your multivitamins. A lot of them are trash as far as the dosing. I know Pure, you mentioned Pure before, Pure Encapsulations makes a pretty solid blend, as does Thorne. I use the Thorne one. The methylene blue is occasional. What else is in there? Oh, I do take NMN. I have NMN gummies. And what's the...
Is the bioavailability still good in gummies versus pills?
It can be.
Still pretty decent?
Yeah. I mean, I make sure I chew them up really well. I think that's a difference. I've heard that. I think like the dosing is a little questionable. But like, I feel like I've had really good feedback from them. So
have you seen the creatine gummies?
I haven't seen those. Oh, creatine's a big one. We didn't talk about creatine.
We did not. It's kind of kicked in my head how creatine gummies is the hottest thing in the market. Creatine toothpicks and creatine gummies have been the hottest thing of 2026. One of those makes sense. Second one doesn't really make any sense, but to each their own.
Yeah. Huh. No, I haven't seen those.
Let's go into creatine really quick. We can go strength, water retention, power output, the mental aspect, just kind of anything you know. Let's dive into creatine really quick.
Yeah, I've been the kind of the newest thing I feel like that's been coming out about it is the cognitive benefits, right? Because before it was predominantly just being used for like training, muscle mass. So yeah, there's testing showing that it's fantastic for cognitive functioning. I even saw this other thing come out saying creatine is the only thing that can combat sleep deprived brain fatigue.
Really?
Oh yeah. Now this is not meant to encourage anybody to sleep less, because less sleep will still mess up a lot of other shit in your body. But if you ever are coming off, a poor night of sleep or jet lag, right? Travel, creatine can really help prevent that jet lag, get your brain kind of firing again.
Yeah, I don't think I have anything else to add about creatine. One thing I had left in mind was electrolytes. So I just want to talk about hydration really quick, because something I've seen, I know I'm different. I have the empty effort gene. So I could drink 10 gallons of water, I'm still dehydrated. But assuming you're not like me, let's talk about hydration really quick. So when it comes down to electrolytes, how do you feel the average person does when it comes to hydration? Like, we know that people drink water. We know that people know, or they just have a bunch of salt on their food. No, but they should. I have a follow-up question to that, but does diet soda count as water in your eyes, or is that not enough to hydrate you? Will that dehydrate? How do you look about?
For sure. No, it's going to dehydrate you. That is not. That does not
so
count.
If you're dehydrated and you drink a bunch of diet soda, like TikTok says to, you think that's going to dehydrate you more, correct?
Yeah, that is not how. That is definitely not how I would recommend to rehydrate.
Exactly. Now, what if you have a shit ton of water, but you're not having sodium, you're not having potassium? Sure. Kind of break it down for that if you'd like.
Yeah. So our electrolytes help with the movement in and out of our cells. So they are equally as important. So when you're dehydrated, it's like, yes, fluid intake is essential, but getting your electrolytes in there. So I even like to get away from Gatorade because of the sugar content. You can get the sugar free. Is it any better? But Pedialyte is pretty low in sugar. You have your electrolytes in there, so it's a good source. And then there's a ton. All these brands are now coming out with like the packets, right? With the electrolytes, liquid IV. So they have a good amount of electrolytes in there. So yes, when you're rehydrating, definitely get the water in, but getting the electrolytes in there too is only beneficial and can impact how well your body and your cells predominantly are absorbing that water.
Okay, cool. No, I think that's all I have for the basics there. No, I guess I want to leave it up to you really quick. I have a final question to finish up on, then we're done. But anything you want to discuss with me? Any question you have for me personally? Could be anything, really.
No, but you mentioned MTHFR, which is the methylene gene disorder.
Yep.
TMG is something that helps with methylation. It's like a methyl donor. So that in general, even if you don't have a methylation disorder, it will still optimize your body's ability to methylate everything. So
is that a vitamin?
Yeah. It's so you can get trimethylglycine compound. But you'll see that it's actually in, I think you can get it by itself. Personally, I haven't looked. It's actually in the NMN gummies I have has it in there. It's in that blend. So that's how I get the source from there. But again, same thing. Like I look at it and it seems like a low dose. So that's actually something I myself say. I told you we're like our worst patients.
There we go.
I need to look and see if I can get that like on by itself, so I can get a higher dose.
I can find you any drug in the world, bro. Just ask. I'll see what we can find. Call the compounding pharmacy. They'll make it for us. All right. That was pretty much everything I got for you off the top of my head. But I usually like finishing up with if you could tell your younger self one thing, or if there's something that you wish you would have known at an earlier age that you now know now, what would it be? It could be anything at all. Something maybe you wish you would have known at 16, 18, or early years in college, whatever it is.
Oh, yeah. I mean, I will say I'm thankful that I've got into this field now when I have, because a lot of these practices, right, or like services, treatments that I'm now utilizing, I wouldn't have even considered probably until like my 50s or 60s, right? Like we all feel like we're doing fine. And a lot of this stuff is, you don't have to be doing bad to utilize this, right? It's going to help like, rejuvenate or restore or prolong, right? Elongate too, your body and its health. So I'm glad I found this now, because it wouldn't have been, if I didn't get into starting this business, I wouldn't have been looking at this stuff. So with that said, I don't know, spun the question a little differently, but
still the same general answer.
Yeah. Same general idea.
Do you see yourself, I know we talked about this off camera, but do you see yourself getting into a clinic that's going to have EBOO or ozone or red light therapy? Just do you see yourself doing that, or do you want to take an entirely different route at some point, or do you still love this for the past? You want to make it grow?
Yeah. And I think all of those like biohacking modalities are excellent, right? I think they all have their place. They all have their benefits. So yeah, I would EBOO. I mean, EBOO is a little more specific as to like who would really, sure anybody would benefit from it, right? But yeah, autoimmune diseases are huge, right? Like, but it's so great and beneficial for those particular individuals. But yeah, red light. And red light's something too, like it's the panels are so overpriced. It's ridiculous, but it's something that is easy for people to get at home.
Yeah.
Even if you get a little small one, right? Little small one, put it over your face, put it over any injured site. It doesn't have to be, it goes through clothing. So you don't have to, it doesn't have to be direct skin contact.
I didn't know that, to be honest.
Yeah.
I'm all naked on my freaking red light therapy table, but okay. Makes sense.
Yeah. So I've been told. Again, I haven't done my own studies. I haven't laid under it without clothes and then with clothes to see if I felt a huge difference. But my acupuncturist uses red light, and she put me under it, and she laid there herself, and she didn't take her jacket off, you know, like, or like her like long sleeve. I'm sorry, long sleeve, you know. So yeah.
All right, cool. I think that's pretty much all I have on my end. Where can people find you, social media wise, business wise? How can they book you for an IV therapy? Give us a quick breakdown of everything about you.
San Diego area, creativehydration.com. That's creative, no E at the end. So it's like create IV. And then social media, it's just at Creative Hydration.
Yep. I found him on Yelp a long time ago, and he was top rated. And I was like, oh, I'll give him a try. Been going back for like a year now. 2 years on. It's been a while.
It's been a while. Yeah. Might be 2 years.
But nonetheless, keeps me alive and happy. So thanks again, man, for hopping on. Hopefully everybody learned something from us. Probably going to continue having episodes weekly or bi-weekly, guys. So coaching, all my merch, Biomyst, everything is in the Linktree. You'll see everything below, and stay tuned for the next episode.
Awesome. Thanks, Kodi.
All right.